Welcome to the deep dive. Ever notice how, even with medical advances, your doctor might seem, I don't know, more rushed? Or wondered why healthcare costs just keep creeping up?
Yeah, it's a common feeling.
Today, we're looking at something often hidden behind those experiences. A really significant human cost in healthcare, and it directly affects the quality of care you end up getting. It's definitely more than just dollars and cents.
Precisely. And our source today points out that our healthcare systems are kind of riddled with what they call defects in value.
Defects in value. What does that mean practically?
Well, the numbers are pretty stark. Think about this.
Yeah.
About 1 in 10 patients actually experiences harm while getting medical care.
1 in 10. That's high.
It is. And get this, nearly 13% of all the money spent on healthcare goes just to managing the consequences of that harm. It's baked into the system.
Wow. So the research we're digging into, Reducing the Value Burden Ratio by Runnels and Pronovost, it tackles this head-on, right? They talk about an efficiency-thoroughness trade-off.
Exactly. It's this core tension. Doctors, they genuinely want to give great care, but the system keeps piling on new metrics, new tasks.
Well, they're caught.
They are. They either have to cut down the time with each patient, which nobody wants, or they work these completely unsustainable hours.
How bad does it get?
Well, the analysis they cite is pretty eye-opening. It suggested primary care doctors would need something like 27 hours in a single 24-hour day just to tick every single box required of them.
27 hours. That's literally impossible.
Right. It perfectly illustrates what the source calls the burden.
Okay, so that's the burden side of their value burden ratio. It's not just about being busy.
Not at all. It's the extra time, sure, but also the drop in job satisfaction, the stress, and even negative outcomes from administrative decisions, what they actually call administrative harm.
Administrative harm, that sounds serious.
It is, and tackling this, the source says, isn't just about a quick fix or a new piece of tech. It's what they call an adaptive challenge, meaning it requires fundamental shifts, changes in mindset, in behavior, in the culture of healthcare itself. It's deep work.
So if this burden is such a huge problem, what's the way forward according to the research? How do we start to fix this?
Well, the key takeaway is that leaders need to make reducing this burden a distinct strategic priority, not just a side project.
Okay, so step one.
Step one is for leaders to really genuinely acknowledge the suffering and discomfort the current system causes for clinicians, for patients, and then crucially, paint a compelling, hopeful picture of the future.
A future where?
Where you get both better patient outcomes and a sustainable, decent quality of life for the clinicians providing the care. It needs real vision, not just telling people what to do.
Right, not just more demands. So after setting that vision, how do you actually start chipping away at the burden?
Okay, step 2 is building dedicated space and time for teams on the ground to actually identify these burdens themselves and come up with solutions.
Giving them the power to fix things.
Exactly. And it involves asking some really sharp questions in a specific order, actually, like what tasks can we just stop doing?
Stop entirely. Okay.
Then what can be automated? Then what can someone in a less costly role handle? Then what can be outsourced? And finally, what absolutely must stay with the clinicians? That stays sacred.
That's a really practical framework. Are there examples of this working?
Oh, definitely. The source gives a great one from an ICU, an intensive care unit. They introduced new checklist items, good things, aimed at stopping serious infections like clumsy.
Central line infections, right. Important stuff.
Very important. But it was overwhelming the staff. So instead of just adding more work or rolling back the safety measure, leaders paused adding new things and challenged the team. How can we reorganize our workflow to fit this in without increasing your burden?
So reorganize, don't just overload. Smart.
Exactly. And another one I found really interesting was in primary care. Doctors in a Medicare program had achieved financial savings for 5 straight years.
Which sounds like success.
Right. But their job satisfaction was actually going down. So leaders brought groups of these doctors together.
And what happened?
The doctors started sharing literally dozens of micro-experiments, small things they were already trying on their own to reduce their individual burden.
Wow, so the solutions were kind of already there, bubbling up.
Pretty much. And bringing them together validated those efforts. It energized them. It showed leadership was actually listening and valued their ingenuity.
That's powerful. What about disagreements? Like the source mentions clinicians might have different views on things like dame-based work.
Yeah, that happens. But good leadership, according to the source, encourages that debate rather than shutting it down. Then, They commit to running properly funded pilot projects, well-resourced pilots, to test out the different approaches and let the teams figure out what works best for them.
So empowering them to find their own solutions through evidence.
Precisely. It lets the teams build the solutions themselves.
This whole deep dive, it really hammers home that just demanding more and more from clinicians isn't the path to better value. Often, it just ramps up the burden and, counterintuitively, might even lead to more harm.
Absolutely. We're really only starting to figure out what the ideal value-burden ratio might be.
But
But it's crystal clear the current burden on physicians, on clinicians generally, is way too high. Reducing it isn't just, a smart strategic move for performance.
there's more to it.
The source puts it very powerfully. They say reducing this burden is fundamentally an act of love.
An act of love. That really reframes it, doesn't it? It's about the human side of medicine.
Yeah.
Recognizing the people delivering the care.
Exactly. It's about sustainability for everyone involved in healthcare.
So, thinking beyond healthcare for a moment, what stands out to you here? This idea of consciously balancing the value we create with the human cost, the burden. Could we apply that thinking elsewhere? Maybe in other demanding jobs or even just managing our own lives to find that better balance between well-being and productivity?
That's a great question. Definitely something worth mulling over.
Indeed. Food for thought until our next deep dive.